Taking care
Hi
of your
guys,
mental
good day
health
to
is
everyone on my
important.
TikTok page. My topic today is mental health. Mental health is very much important. Mental health can be classified as a syndrome characteristics of a significant disturbance in one's cognitive, the mental functioning of the brain. It causes a dysfunction in biological, environmental, and emotional well-being in one's life. A lot of people in society goes through a mental health crisis. When mental health, whether they are experiencing a psychological disorder, whether it can be bipolar depression, some women after giving birth, they go through postpartum mania, whereas they experience feeling depressed, feeling sad, lachrymose. Some of them even experience going through major depression. Some of these mothers, some of them, they have the thought of unaliving their child. And during the time of postpartum mania or postpartum depression, the mother who just gave birth is just need some form of intervention, where she will need to seek some form of therapeutic help, where she possibly may need some type of meds to stabilize the dysfunction which has been caused with her brain. As of today, there is a large percentage of people who are unaliving themselves. Some of them are unaliving themselves because they are overwhelmed with the stresses of life and what life has to offer. What life have to offer? Exhaustions of working for extremely long hours. Working and receiving an income which is not sustainable to survive. Some people are overwhelmed in relationships. Some of their relationships are toxic. Probably they have to experience being in a relationship with a narcissistic person who is projecting narcissism behavioral traits. Some women are experiencing SA, DV, some type of abuse. And people in society are experiencing different mental disorders. Mental health is a wide range of different mental disorder. It can be categorized as biological, which is some part of the neurotransmitter of the brain has a dysfunction. Sometimes patients who have schizophrenia, what is happening, the dopamine, there's a dysfunction with the dopamine in the brain, and therefore that individual will need to be placed on meds to stabilize the dopamine in the brain. And then some patients with depression, they will have a less serotonin in the brain, and they will need to be placed on meds. So what is happening is we are living in a society where mental health is very much important. And when someone will say that they feel depressed or they feel exhausted, some people will even express how they feel. They feel like unaliving themselves. Sometimes we as individuals who are around these individuals, we will ignore them. We will not give them a listening ear. But if someone is around your circle and you hear them speaking of that they want to unalive themselves, or they're speaking of a place of feeling depressed or feeling anxiety, nervous, advise that person to seek help. Please offer intervention. Because a few weeks ago, someone who I know that is very close to the family, that person unalived themselves. That was the person's second attempt, and the second attempt was successful. Family members met that person trying to hang themselves, and they took intervention by stopping that person. But because that person was not placed on meds, or that person was not given therapeutic help, therefore the person made a second attempt, and therefore the second attempt was successful. And as of today, that individual has been unalived. So what I'm saying is, there are lots of people in society are going through some type of mental health crisis. There are people in your circle, there are people in your family group. There are also even you as an individual who are experiencing some type of mental health crisis. And when we speak about the word mental health, a lot of people there is a stigma that surrounds mental health. The stigma that surrounds mental health is the way that society looks at mental health. They look at mental health as crazy people. And as I said earlier, mental health comes in different categories. Mental health can be, you can be depressed, you can, a woman just gave birth, she can possibly be going through some type of postpartum depression, or substance abuse of alcohol, abuse of drugs. That is also under the category of mental health. And these individuals, what they are, they just need some form of intervention, because mental health is a crisis and there needs to be intervention, whether intervention with meds or intervention with allowing them to seek therapeutic help. Some people go through the experience of losing someone close to them, and they will go through some form of social deviant. They will go through that feeling, whereas they probably may have an attitude, curse people out. But not the fact that they want to act like that, it's the fact that they are going through that period of stress, whereas they lost someone close to them, or probably experience some type of stressors of life. And what they do, they start having an attitude. Okay? Understanding people is the main key in life. Earlier this week, one of my patient family member, I saw the woman crying. I stopped her and I asked her, I said, "Are you okay?" She said no. And I gave her time to explain herself to me, because I was a bit concerned. And I asked her the question again, "Are you okay?" She said no. And she started to express to me what she's going through in present day. That her family member, her brother, is abusing her. And I listened to her attentively, and I was able to give her words of encouragement. Words of encouragement to disconnect yourself from that type of environment. Disconnect yourself from that type of situation. She told me that she's going to seek therapy. She has a first appointment coming up soon. And I said that is a very good step that you made by seeking intervention. I also talked to her and I let her know that it's okay to cry. Because the more you cry is the more you're going to be healed. The more you cry is the more you're going to be restored. It's okay to cry. It's okay to say that I need help. There is no shame in saying that I need help. And a lot of people in society, what they do, they need help. They need some form of psychological help. But what they do, they hide under a rock. And what they do, they try to deal with that type of emotions all by themselves. But I want people to know that there is help out there. There is different mental health places in every one's country. If you're living in Trinidad and Tobago, there is mental health intervention. Here in the United States of America, there is mental health intervention. There is hotlines where you can call and you